another important disorder which is actually hemophilia. So let's start. Bismillahirrahmanirrahim. Hemophilia, which is the most common and severe clotting disorder. Basically, if someone has hemophilia, if that patient have even a small cut, so bleeding will start and it will not stop. Okay, it is actually a congenital bleeding disorder. There is a lack of coagulation factor 8 and 9, which is actually designated as hemophilia A and B. In hemophilia A and B, there is a lack of two coagulation factor, which is 8 and 9, and you have studied in your physiology about this in complement system. Okay, now the clotting time is increased, means the you have increased clotting time because there is a lack of coagulation factor. Before this we have studied in if I'm not forgotten, so we have studied in thrombocytopenia purpura that the bleeding time was increased and the clotting time was more, because the clotting time was normal because the coagulating factors were normal, the cascade was normal actually. Okay, but here the cascade is abnormal, means there is lack of coagulating factors. So basically we have increased clotting time. The normal is 2 to 5 times. Male are sufferer and females are carrier. You have studied in your biology this basically that male suffers and females are carriers, because in females you need two genes basically to be dominant, and in male if you have one, so it is dominant actually. Hemophilia basically occurs in by 6 by 1 lakh of population and 10 times as common as hemophilia B, Christmas disease, factor 9 deficiency. Okay, now basically extraction are still common emergency severe. Okay, when in instructions, if patient is hemophilic and you do extraction sorry, and you does not know in your history, so there will be a continuous bleeding. So hemophilia effect in childhood, bleeding into muscles and joints after minor injuries. Okay, mid hemophilia factor 8 actually over 25% counts, means if a patient has basically mild hemophilia affected 8 lakhs, so it is 25% can cause no symptoms until injury or surgery. The patient will have no symptoms until he or she undergoes a surgery or an extraction case or an injury. Okay, now precipitated prolonged bleeding into the soft tissues can follow. Basically you have local anesthesia injection या submucous infiltration, yeah, you have ID and blocked ranges due to the plexus of veins and blood can lead down to glottis. Okay, now the main thing was that it is a clotting disorder, number one. Second, it was a congenital bleeding disorder. Third, there were two important factors, 8 and 9 was lake, and basically clotting time is more, 2 to 5 times is normal actually, more basically. And now moving towards clinical features. Positive family history the patient will give. 30% have negative family history, but accidental discovered results of post extraction hemorrhage can occur. Bleeding start after a short delay as a result of normal platelet and vascular response, which provides the initial phase of the hemostasis. Persistent bleeding, if untreated, can continue for weeks until the patient does a pressure packing, suturing, or local application of basically hemostasis are ineffective. Hematoma, intracranial hemorrhage can be result. Deep tissues bleeding can spread from the neck, obstructed the airway. It can obstruct your airway. Many hemophilics are carriers of HBV, HBC, HIV as a result of receiving untreated blood products. Means that you do not do proper screening of the blood transfusion, and it may contain HIV, and the patient can also become infected by the HIV. Okay, now we can basically diagnosis and through lab findings. Prolonged basically you have prolonged activated partial thromboplastin time. Normal is your basically the prothrombin time is normal, your bleeding time is normal, but you have low factor 8. precautions is that local anesthesia is absolutely contraindicated because of continuous bleeding and hematoma and formation due to prick. So the patient with hemophilic, you will not give the local anesthesia because there are chances of continuous bleeding and hematoma. General anesthesia is preferred and patient is hospitalized. Fresh blood plasma, fresh frozen plasma, yeah, cryoprecipitate deficient factor you can give in this patient. Okay, so hemophilic globulin, which is very important, anti-hemophilic globulin fraction 1 400 milligram in 20 cc of the normal saline within the half hour the clotting time is reduced to normal. Then you have anti-hemophilic globulin level should be in 20% above normal or normal level. Basically factor 8 should be built up to 50 to 70% in patients. Mass anesthesia is to reduce the risk of breaking in OT or to avoid the endotracheal intubation because of the danger of the bleeding. So the mask anesthesia is best given to reduce the risk of breaking in OT and to avoid basically the danger of bleeding. A traumatic procedures are carried out with no stitching, means you can do a traumatic procedures and you don't need to do stitching. After extraction, one should pack the socket with gauze or with the sponge stain cubes of 12 hours, means you have to do packing with gauze or with the cubes of 15 hours afterward. If bleeding occur after 4 to 5 hours, fraction 1 should be given when clot is settled. No more fraction 1 or maintenance is required for this. Now you have hemophilia B, which is a Christmas disease, actually inherited clinically identical to hemophilia A. Clotting factor 9 is more stable than actually 8, and right factor 9 infraction is given for replacement. Okay, factor 9 will remain active in the blood for more than 2 days, it means, and the replacement therapy should be given at longer intervals than for the hemophilia. All other aspects of management of hemophilia A and B are the same, means you have to both are same. Factor 9 is more stable than 8 actually, and then the dried factor 9 is given, and then the 9 is for almost 2 days. So the replacement therapies can be longer as interval than for the HA. Now, one will brain disease, actually it is characterized by when you have increased bleeding time. You have increased bleeding time, deficiency of factor 8 is here. It is very important which factor is missing in this. Then inherited, it is significant clotting defect, platelet defects correctable with the desmopressin. You will give desmopressin actually. It is also sufficient to carry any specific significant factor 8 deficiency. Severe cases is decreased factor 8 is such that surgery has to be managed as for hemophilia A. Factor 8 is active in the blood for longer period of time. So